How's it going, guys? Dr. Jonathan here. I just want to show you something that a lot of people have a question about, and I really want to explain it to you. A lot of people think that chiropractic care causes strokes. All right, I want to explain to you why this is and why it's not entirely true. First of all, there's many different ways to adjust people. It doesn't have to be that manual crack and pop, which I hate those words because we're not cracking anything or popping anything. That's just gas leaving a joint. But let me explain to you when a stroke does occur when working with somebody's neck. So if you look at this, if you can see this red through here, that's an artery. Notice how it goes through the bones in here. Okay, this is what we call our vertebral artery. It supplies blood to the brain. When we sever that artery, that's when a stroke can occur. Now, how is that possible? Well, these joints back here in the neck are called our facet joints. If these are functioning properly and they're not injured in any way, there's no fracture, they actually prevent the spine from over-rotating. It would have to be some type of injury in here or a very, very severe calcification, hardening of this artery in order for that artery to sever. Otherwise, think about this. Anybody who's ever been into a car accident and had whiplash, how come you never hear about people having strokes after car accidents? I'm not saying it never happens, but you don't hear about it that often. You always hear about, oh, this person went to a chiropractor and they had a stroke after he adjusted them. Well, if that is the case, first of all, those are about 1 in 3 million. And 2, it's usually because that person never had any x-rays taken, never had any exams taken. Actually, in most of those documented cases, the person was already complaining of things like very bad headaches, lightheadedness, dizziness, signs of a stroke leading up to that. And in a healthy spine, if there's no fracture, no calcification, and none of those symptoms, it's almost impossible for that to happen. This isn't a Bruce Lee movie. We can't just crack your neck and spin it off, right? It's very, very hard to do. Like I said, in a car accident, you don't hear people that happens all the time, right? You hear people get fractures in their neck. How come they don't stroke out when that happens? It's actually very, very difficult to do. What we do is very, very safe, especially if you take the proper precautions and x-ray and exam and take the history, then we don't have a problem with that. The other thing is that we don't have to do a rotatory adjustment on the neck in order to adjust it. We can use things like an activator where we're just applying posterior to anterior type of a movement. Instead of a rotation, we can do a drop table where we can still work with the neck, we can still adjust it, and not have to have any risk of having that stroke or serious injury. And like I said, the most important thing is take the x-rays, do the history, do the proper exam, and then you really limit the risk of this happening. And even if somebody was completely negligent, those are still 1 in 3 million chances. You're actually more likely to have a stroke in a hair salon than you are in a chiropractor's office. It's true. If you found this valuable, like the video, tag somebody, share it, and keep watching for more videos, guys.